Hello, my name is Tom Basie, and I'm about to make a 2021 Medicare Advantage Clarity presentation and record it, make it available. Hopefully this is going to make Medicare and Medicare options very clear to you. It's nice for you to stop by today. So this is me. My name is Tom Basie. I've got my phone number and Gmail email address there. Aparte hablo español. I'm here to help. So after this presentation, please feel free to reach out to me. Let me know if I can answer further questions for you. This is the agenda of this presentation. I want to talk about some choices you have within the Medicare world, talk about the eligibility enrollment. I want to mention the advantages specifically of Medicare Advantage plans. I will spend a few slides on prescription drug coverage, which is an area of question for folks in Medicare, so I think I've got some good information for you there. I'm going to show you some specific 2021 Medicare Advantage plan information. May not be the exact plans in your area, but I would venture to say there's some plans similar to this, so it'll be some good information to look at, see how you can kind of compare plans. Talk about how an agent like myself can assist you, talk about some additional resources that can be made available to you, and then I will mention United Healthcare, some reasons why you should consider them as your Medicare coverage source. So step one, enroll in original Medicare. Part A is covers for hospitalization. Part B is for outpatient, doctor's visits, testing, anything not done in the hospital. Those two areas. Part A is often covered by people as they work here in the U.S. and they take the FICA tax out of your paycheck. That's often for Social Security and Medicare Part A. So I'm looking forward to getting Medicare eventually myself, and I will have Part A already paid for. Part B, you do have to pay for that once you sign up and start getting it. So Part A for hospitals already paid for. Part B you have to pay for as you join. You get a Medicare card, red, white, and blue with your name and Medicare number and the effectivity dates of both Part A and Part B. They don't have to be at the same time, but often it can potentially be even automatic these days when you pass that, and you'll get some information from Medicare as you approach those days. In 2020, the deductible was around $1,400 for Part A, the hospitalization, and it was around $200 for Part B. For most people, the standard premium for Part B, that thing you have to pay monthly, is less than $150. So that's Medicare in a nutshell. Now, once you do Medicare, you have some alternatives. That all comes from the federal government. You have a couple options from different carriers. You can get a Medicare supplement and some drug coverage. Medicare supplement policies do not have drug coverage in them, so you can do it that way. That's option one. Or you can get an Advantage plan. An Advantage plan has drug coverage included in it, and it has additional stuff. It potentially has some vision benefits, dental benefits, potentially hearing benefits, and other. So you can bundle it in one pile, an Advantage plan, or you can get a Medicare supplement and a drug plan. Either of those options is a nice way to complement Medicare through carriers like United Healthcare. Now, eligibility, you got to be 65 years old. Well, there are some exceptions. If you get disability, some other specials, but as a general, people are 65. Similarly, it's a U.S. citizen or a legal resident who's lived at least 5 consecutive years. So approximately it's 65 and U.S. citizen. There are some exceptions. Initial enrollment period. It's a 7-month window initially, 3 months before, the month of, and 3 months after the birthday when you turn 65. So you can enroll in Medicare Part A and Part B. And you can enroll in a drug plan at that time as well, and or an Advantage plan or MedSup. Now the thing is, if you don't do Part D, if nothing else, you do nothing else, there's a penalty for not signing up for Part D coverage. If you wait X number of months or years until you sign up for drug coverage, there's going to be a penalty because they want you to sign up. Even if you're not taking meds, they want you to sign up for a drug plan to have that coverage. Otherwise, there will be a penalty. 1 month of the average monthly premium for each month you delay enrollment. So don't delay. Sign up, get some kind of Part D coverage, which is D, think of drugs. Okay, some other annual enrollment periods. Maybe you've already got a Medicare Advantage plan to source. For example, there's actually an annual enrollment from October 15th to December 7th. You can add, drop, or switch medical coverage. Then the first quarter, January 1 through March 31st, there's actually an Advantage open enrollment period where you can do a one-time change. You can disenroll from the current plan or switch or go back to Medicare. So this one's more flexible. There's certain things you can do only in that, but at least those two options arise. There are actually a couple other things. There are special enrollment periods. If any of these events occur, well, that's a special enrollment throughout the year that potentially you could use. If you retire, doesn't matter what month it is, if you retire and you don't have medical coverage anymore, you can get on Medicare and or an Advantage plan. If you move out of the service area, if you've already got an Advantage plan, they're often zip code network based. And so if you moved out, then there's a special enrollment period you can get. In fact, you would need to, I would argue, switch and get a new Advantage plan, for example. If you qualify for extra help is financial assistance from the federal government. So if you become financially challenged and you get extra help and there's a special event, you can sign up for plans then. And then if you get diagnosis for certain chronic health conditions. So 4 different things can occur, kind of like life events, but these are special enrollment periods if these things occur. So you can also, in addition to 2 windows we already talked about, you can make some changes or sign up for an Advantage plan, for example. Okay, the advantages of Medicare Advantage is really some nice statistics for around 2020. 24 million people have them in the U.S., have some kind of Advantage plan. Of those, over 90% of them are satisfied with them. And the reason is because 25% spent less on healthcare compared to Medicare. So those are just some compelling, straightforward statistics on why one should consider an Advantage plan. Okay, to compare original Medicare versus the Advantage plan, because if you get an Advantage plan, you carry around the Advantage plan card. You no longer carry the Medicare card. You can leave that at home. Both of them have some coverage for hospital stays, some outpatient stuff, doctor, and then things like preventative service. But what original Medicare doesn't have right here, an Advantage plan does has, it has prescription drug coverage. There's some routine vision coverage. There's potentially routine hearing and or even dental sometimes plans coverage. And then there's at least a limit on the out-of-pocket maximum. There's one note on there, merits saying a second time, there's no out-of-pocket maximum on Medicare. At least with the Advantage plan, there's an out-of-pocket max. Now this does vary by plan, but that's kind of comparing the two. So okay, that's all I'll say about that. I'll reiterate some of these again. Okay, this is the top 10 advantages of Medicare Advantage, not necessarily in order, but I would be remiss if I didn't remark on these. Number one, you do have to continue to pay your Part B Medicare premium. So no matter what the Medicare Advantage plan costs, frequently it's a very small cost, sometimes even $0 per month, you do have to continue to pay Part B to have a Medicare Advantage plan. Advantage plan has you covered, that it's the same thing as Medicare covers and then some. Joining an Advantage plan may affect your current coverage, something to think about. Either because you're at work, you could get off the work health insurance and get on Medicare coverage. If you're a veteran, you could actually add an Advantage plan even and keep your existing coverage as long as, for example, you get one that doesn't have drug coverage if you're getting your drugs, for example, from the VA. It's best to use network providers. We almost never say best in the network in the Medicare world, but we say it there because by definition, there's lower cost. And so if you go out, sometimes you can go out of network for stuff, but if you go in network, that's where the best cost or the lowest cost is. You may qualify for financial assistance. There's some implication of that as well. We kind of already see there's a special enrollment period. There's actually even certain special Advantage plans for someone who's, for example, on Medicaid and Medicare, or Medicaid is the financial assistance at the state level. I mentioned this once, but I got to say it again. If you enroll a Part D, which is drug coverage late, you may pay a penalty. So you can either get a standalone drug plan or you get an Advantage plan. Well, it takes care of that. So as soon as you enroll in that, you're not going to be subject to that penalty further, if at all. A Medicare supplement insurance plan is not a Medicare Advantage plan. That was like the first slide I showed of option 1 versus option 2. Medicare supplement doesn't have drug coverage. You need to get a drug plan. It costs significantly per month, but has very thorough coverage. Medicare Advantage plan costs $0 per month. It does have drug included, have some dental and vision, and there are some copays though typically for as care is administered. Keep your member card handy. You carry that thing around, no matter if you're going to the doctor, the dentist, the hospital, a vision thing if you're using that in plan. Dentist, you take your Medicare Advantage claim around. Medicare Advantage offers the same protections as original Medicare and then some by that side-by-side comparison with the checks that I showed you previously. And then you have a built-in safety net. What I'm saying there is no out-of-pocket max. So if somehow you have a big, huge bill of care during the year and it adds up to $100,000 bill, well, the most if you're using original Medicare, you're going to pay all their deductibles. And then, for example, if it's outpatient, it's 80-20, so you're going to pay 20% of whatever that big bill is. Or conversely here, you're going to pay at best your out-of-pocket max. Maybe it's $4,000, $5,000, whatever, but at least you know it's set and it's not going to exceed that. So you have a built financial safety net built in. I really like that aspect of a Advantage plan. Okay, I want to talk about drugs a lot. People like to ask things like, hey, I go to the same pharmacy and I'm getting the same medications. Why does it cost different amounts sometimes? This shows why. It's defined by the federal government. This is how these things work. There's an annual deductible period. There's the initial coverage after you've met the deductible. Then there's the coverage gap, also called as the donut hole, where prices change. And then actually, once you get out of the donut hole, you go to the other side, there's catastrophic coverage. So that's why a single medication, even or group of medications at a same single pharmacy costs different amount. Number one, you have to meet a deductible. So let's just say you have a $200 deductible and your medications cost $100 a month. Well, the first 2 months, you're paying the whole price because you haven't met the deductible. Initial coverage is once that kicks in. And let's say for whatever reason, the copay on that medication, that same example, if it's $100 a month, if it's if your copays are basically $10 for that, then after you've met that, that was months 1 and 2. Then in March, once you've met the deductible, now you're paying, let's just say $10 a month. Okay, so annual deductible met, and then initial copay coverage. The gap is once your total out of pocket exceeds $4,000. So I'm going to change my example. I'm going to say if it costs $1,000 a month your medications, and you're only paying a coinsurance of $100 a month, for example, on that. Well, after once you've paid over $4,000, so into month 5, for example, then you're in the coverage gap. You're going to have to pay 25% of it. So here the copay was only $100. Once your total costs exceed $4,130, you're going to pay 25% of it. So $1,000 a month, that's $250. So it jumped from $100 a month to $250 a month in that example. Now, once you're in the month 7 or so, once you've paid the total cost of your medication exceeds that, then you're back to catastrophic. And then you'll pay either these lower copays or 5%. For my example, I'll just use a 5% example. So if it was $1,000 a month, that's $50. So in that example of $1,000 a month bill, you paid $100 copay for the month's years once you until you reach $4,000 of total cost. Then it jumped to $2,500. Then once you exceeded that, drop back down to $50. So that's why for single medication or cost of medication at a same pharmacy, things cost different amounts. Okay. So that was based on total drug cost. I want to reiterate that, not the copay which you paid. So the notice of the bill or the retail price is $1,000, even though you're paying $100. That's the total cost of that. Out of pocket is what you pay, for example. That's the copays that you pay. And any deductible, if you have to reach that, that's your out of pocket. That's the difference between those two. And this is the one that's used to calculate the donut hole when you enter that. Okay. Pharmacy network. This is United Healthcare, has over 65,000 pharmacies in their network. That means there's a pharmacy in network near you, likely. You will save on prescriptions if you go to the network. You can also save on mail order. So there's a lot of them nearby. You can save if you go to one of those, or you can use mail order. Doesn't mean every single pharmacy will take this, but the guidance here is use this if you can. The drug list is called a formulary, and it is tiered. Every drug on the list is in tier 1 through 5. Tier 1 is preferred generic drugs. Tier 2 is generic drugs. Tier 3 is preferred brand name drugs. Tier 4 is non-preferred drugs, and Tier 5 is specialty drugs. The lower the tier number, the lower the cost. Sometimes on some plans, a Tier 1 drug can be a $0 copay. So as long as you've met the deductible, if there is one, then you're going to pay $0 for a Tier 1. Or conversely, Tier 5 are expensive, and typically you're going to pay a percentage. Can be over 25%. So I've seen them in the 30s, the percentage of the drugs, because those are specialty drugs. So the higher the tiers there are, sometimes the drug deductible even vary across. Sometimes you'll have a deductible for $0 on all these. Sometimes you'll have a drug deductible of $0 only for Tier 1 and 2, and then a higher deductible for 3, 4, and 5. Okay, a few more remarks about drug coverage. Step therapy is when you first try the lower cost medication first, and then go to the higher cost medication if the first one isn't effective on treating a condition. Quantity limits, as the name applies, it's when on a monthly amount or number of days, quantity or number of dosages someone can get. Sometimes those are limited. And then prior authorization. Sometimes a plan will require that a doctor authorize it to make sure it's being used correctly. And so it's something to consider to try a different one before doing one that requires prior authorization, just to overcome that challenge of getting the drugs. Having said that, you can get exceptions. So if it's not currently covered, you can ask if it can get added or have formulary exception. You can ask to get restrictions waived on those. So if your doctor submits a request on your behalf, typically you're going to get a decision within 72 hours. And it can be expedited if the doctor believes your health requires it. So there's some ways to kind of fight through or overcome any exceptions if you have a drug prescribed that is subject to some of those exceptions or rather restrictions on the previous page. Okay, now I'm going to share with you and compare 4 specific plans. These plans happen to be in Texas, in the Dallas area. They're available there, 4 plans. And even though you don't live in that area potentially, that's okay. Similar plans with similar features are likely available in your area. So I'm going to share these 4 with you to show you kind of the differences, compare and contrast them to help you think about, if you did live in this area, which one of these would you choose and why? So Plan 1 and Plan 2, they've been around for several years. The Advantage plan and the Choice are newer plans. They've only been around a couple of years. These 3 are HMO plans. This one is a PPO. HMO means you go in network. If you go out of network, the plans don't cover the care there. PPO means you can go out of network. There may be likely a higher cost copay or something like that, but you have the option to go out of it and the plan will still cover that care potentially. So those are the 3 plans, kind of some newer plans, some older plans, kind of some newer plans, 3 PPOs. Let's see how they differ and how they are similar actually. The monthly plan premium, actually it's 0 for 3 of them. Plan 2, there is a premium. What happens is plan 1 came out and it's similar to plan 2, except that when you pay that premium, you're trying to drive down the copays and or increase the benefits. That one does. The Advantage plan is actually similar to plan. It's the newer version where people were asking for certain things. And so they came up with I might call this plan 2 new, because it's similar to plan 1 in certain features, but it has some, there's some takes and giveaways between the two, and then the PPO. So all of these are 0 month premium, except for that one plan 2 where you're intentionally paying a premium to drive down your copays and or drive up your benefits. Annual medical deductible is 0 on all of those, and the primary care visit is $0 copay on all of them. So actually the first two besides the premium are the same. Specialist visit, it varies slightly. So the lowest one is with the plan 2 where you're paying. So if somehow you're going to special lot, maybe you're interested in paying that premium so you can drive down the copay on that one. The other ones are higher. Specialist referred require. On the HMOs, a referral is required. If you don't want to, if it's challenging, it's hard to get in to get a referral, maybe you're interested in the PPO then, because no referral is required for that one. Preventative services is also $0 copay on all 4. So there's already, you can see some differences, but they're not too disparate except for the premium perhaps on those first few. And here's some examples. If you go and stay in a hospital, the one where you're paying the premium, there's actually a $150 copay per admit. So that's pretty good price to get into the hospital and stay in your hospital stay. For plan 1, there's a $275 copay for days 1 through 5. For these 2 other plans that have certain advantages over this one, but this is a disadvantage, if you will, these actually cost $325 per day, and it's actually an extra day 1 through 6. After that, then this is $0 copay. Okay, so there's a significant financial difference between these 4 plans on the hospital stay. Skilled nursing facility, they're all 4 $0 copay for the first 20 days. Once you go beyond day 21, actually the price per day is the same, $184. However, the number of days you have to pay, that varies. So the plan 2 where you're paying the premium, you only go to day 38 and then it'll drop to $0 after that. For plan 1, you go to day 42. And remember, the new Advantage plan is kind of similar. So both these actually go to days 42 for hospital stay. The Advantage, the choice plan where you have the option to get on network, again, you kind of pay for the flexibility. That one you have to go all the way to day 57 if you end up staying there to pay that $184 a day for that one. Outpatient surgery, those numbers, it's a one-time copay, but the maximum copay reflects the daily rate of the hospital stay. $275, $150 copay is the maximum when we're paying that. And then diabetes monitoring and home health care are $0 copays for all 4 of those plans. They're very similar. So I've got 2 more slides like this, but what you can already see is there's HMOs and PPOs, and you can pay a premium and get lower prices, but these are some of the features to consider when you're evaluating Medicare Advantage plans. Okay. Diagnostic radiology services, these older plans are $125 maximum. There's a slightly higher, only $25 more maximum for the newer plans. Diagnostic test procedures, they vary slightly, but the plan with the paid premium has the lowest one. Lab services are all $0 copay. Outpatient x-rays are $0 copay for all 3 of the HMOs. There actually is a $15 copay for the more flexible plan. Ambulance is the same for all these, be it air or ground, it's $250 copay. Emergency care, similarly, it's a $90 copay. And then urgent care, actually, if you go to an urgent care location, as long as they're contracted, actually either way for the HMOs, it's $40 copay. If they're contracted, it's $30 cheaper on this, and that's kind of because this is built to use. It's just the difference. Now here's the biggest financial difference between these 4 plans: the out-of-pocket maximum. The plan where you're paying that premium has the lowest out-of-pocket maximum. It's $3,200 is total out-of-pocket max, no matter what your cost of care are that year. For the other 2 plans where you're not paying a premium, it's up to $3,900, these 2 similar HMOs. And then for the PPO, it's $6,700. Okay, so that's an example of how it costs a little bit more potentially to have that flexibility. Got another slide or 2 like this. And not going to go through this whole thing, but basically what happens is if you look at tier 1 alone, $0 copay for this one, actually is for this one as well, but the highest copay for a generic 30-day supply is the flexible, the PPO with flexibility. The deductible, the 3 HMOs have a deductible of $0 for all the tiers. And then actually, as I remarked before on the PPO, tiers 1 and 2, there's $0 deductible. There actually is a $345 deductible for drug tiers 3, 4, and 5 on the PPO plan. Okay, a little bit more. These are additional benefits, extra benefits. Dental coverage, there's actually $500 on these two plans, there's $1,000. So if dental coverage is more important, you can either pay to get the premium or you go with the newer plan to get that $1,000 extra $500 dental coverage. Routine vision care, it's all $0 copay for one routine exam, but for eyewear, and this is every 2 years, for eyewear, there's a $100 allowance on the eyewear except for the plan where you're paying the premium. It's actually $200. That's an example of how paying that monthly premium, it drives down the cost of the copays and it drives up the benefits. The older plans actually have some hearing aid benefits, $0 copay for one year routine hearing exam. There are not hearing aid coverage on the new plans. So notice between these two plans, plan one and the new plan, it's kind of a dental versus hearing trade-off. Whichever one of those is more important might affect which one of these you would pick. Insulin savings is the same for all four of these. You can get a month's supply of insulin for around $35 or less for all four of these plans. 3 of these 4 plans have an over-the-counter credit. Perhaps counterintuitively, the paid plan doesn't have that. But what these are, it's a $40 per month. It says $160 per year, but it's $40 per quarter. I should correct myself there. $40 per quarter is really the way those are doled out. And so you have credit, over-the-counter credit, and you can order via phone or on internet. You can get over-the-counter, this is not your prescription drug plan. This is aspirin, antidigestive. You can also get Band-Aids, other stuff. Any kind of personal care or many kind of personal care items that you might get in the pharmacy are available at a $40 per quarter credit on 3 of those plans. And then all of them have a membership in Renew Active, which kind of results in a free gym membership or no cost membership, I will say, for many. And kind of like the pharmacies, not every single gym takes it, but many of them. There's a gym near you likely that will take that Renew Active benefit. Okay. There's some specifics about those plans. I don't feel the need to run through it at length, but what I would offer is Plan 1, Plan 2, the Advantage Plan, the Choice Plan, the ones we saw. Basically, these are counties around the Dallas-Fort Worth area. If you don't live in those areas, that's okay. There's a plan probably similar to one or more of these plans near you, wherever you live, really in the U.S. Okay, just a little bit about United Healthcare. They have over 40 years serving the Medicare community. There are other carriers perhaps, but I don't know if many of them have, if any, have 40 years taking care of Medicare beneficiaries in particular. More people in the U.S. choose their Medicare solution from United Healthcare than any other carrier. There's some statistics, we kind of talked about those, about the 93% satisfaction. There's statistics that show that members they like them and they keep the plans that United Healthcare provides. And you have our promise and commitment to helping you live a healthier life. I spend some time in retail pharmacies representing United Healthcare, and I can assure you that they are about care. They're about saving money and people living healthy lives. I have an opportunity to work with them at length. So that's my endorsement for that carrier. There are some additional resources that can be made available. Medicare Made Clear is a hard copy, maybe electronic available also. It's kind of like this presentation, some basic fundamentals about Medicare and the different options. Medicare Helpline, you can go to medicare.gov and or you can dial Medicare and talk to them on the phone as well. But Medicare people, CMS government employees are available to help you with questions. Medicare and You is a booklet that they often send. It's a pretty thick, thorough booklet that they send to people as they approach 65 years old. CMS, the people that administers Medicare. They can make that available. Online, there are plan finders to help you find plans like this. State resources, you can Google Medicaid in your state and find out online, for example, how to apply for and the benefits of getting assistance this is for low-income folks in your state. Social Security, SSA.gov, you can go online or call them and talk to them. They're available to help. For example, you can, if you went for the Plan 2 plan that I just showed where there's a $73 premium, you can have it automatically deducted from your Social Security benefit, your monthly benefit. And then administration and elder care locator. There are ways to find elder care, for example, online, and there are hard copies typically available as well. So these resources are available. I'm here to help. I would like to help you. Give me a list of doctors and I'll help you determine if they're covered, if they accept the plans. Give me a list of your medications and I'll show you examples. We can calculate what your drug costs will be kind of over time, depending on which pharmacy and which tier it is. It'll show, we can model it and show you the pricing per month at different pharmacies for your medications. Additional resources, I can help you find a gym that accepts a gym membership for one of these plans. I can help you find out more about Medicaid and determine if you have eligibility for that and show you plans that are available. If you do have Medicaid, I can show you plans that are unique to people that are on both Medicare and Medicaid. And then if you're a veteran, I can help you and I can show you plans, for example, that don't have drug coverage. So you can continue to get drugs from the VA if you like, but you can get some of the bells and whistles that are available in Advantage plans like dental coverage and vision coverage. So those are nice benefits of these plans. And I'm here to help you find them and take advantage of them. So again, my name is Tom Basie. That's my phone number, tom.basie@gmail.com. Hablo español si no lo dije antes, así que puedo entender a la gente en su idioma. I'm grateful for your time today. I hope this has been beneficial and have a good rest of your day. Thank you. Goodbye.